Welcome, welcome. We're so glad to have you here. We need help caring for the animals that come in. I'm Linda Wang, the head veterinarian here at the rescue.
I'm Kevin. I'm not a vet, but no one's perfect, right? Lucille and I are vet techs.
Veterinarian technicians. We're here to help you with whatever you need when treating the animals. We take our jobs very seriously.
Speak for yourself. I get to have fun. I'm Joni, the enrichment specialist. That's fancy talk for someone who gets to play with animals all day.
We all have fun when one of our rescued animals gets adopted. But first, you'll need to give them a clean bill of health. Don't worry, I'll be there to review the cases with you. Well, I'm sure you can't wait to get started. Welcome aboard.
Final tally, Louisiane preferred 2-1. It's the clear winner. Folks, the big iced tea taste test is history, and the clear winner is Louisiane.
Welcome, our first 3 visitors. First up, from as far away as the local park, Sunshine, the lovable kitten.
What Kevin isn't telling you is she looks rather healthy. A boy brought in Sunshine as a stray. I wish everyone was as responsible.
Oh, but some are. A couple brought in this macaw, Admiral, after they saw him picking out his own feathers.
But
I like
Daisy
a day
only
that's
came
not
in when
cloudy
her
and a
owner's
tea
parents
that's not
found her.
cloudy. That's
Just
why I
look
like
at her.
Louisiane.
She does
Louisiane's
look a
got
bit
special
thin
tea
for a
leaves that
rabbit.
keep it clear as a bell.
So we should let our
all
doctor
day.
get to work. It's your first day,
If you're
so
drinking
Dr.
Lipton
Wang
or
asked that you
Tetley,
perform a
look at the
wellness
box.
exam on
It tells you
Sunshine
what
with
to
her.
do when it
Just tell me
turns
when,
cloudy.
and I will prepare her for
Louisiane says nothing about
examination.
cloudy, 'cause it doesn't get cloudy. Louisiane, the one tea that's always clear
Since
as a
you are
bell.
just starting out here, I'm going to help you through your first case. After that, you will be the only doctor in the room during treatment. Don't be nervous. We all have great faith in you.
Don't forget me, Dr. Wang. I'm here too.
Oh yes, we can't possibly properly treat a patient without the help of one of our great veterinarian technicians. Kevin will also be here to assist, of course. Well, without further ado, let's begin. Your vet technicians can give you information on each patient that comes in. The information that they have can usually give you clues as to what's causing the patient's illness. Start by asking Kevin some relevant questions about the case. Now, click the green arrow next to a question that's relevant to the case. You'll need to
¿Qué es lo
ask
que vas a
3
hacer
helpful
con todo
questions
este
in
dinero
every
que
case.
tienes? ¿Dinero de dulce?
She was wandering around the park all alone until
¿No
a
les
little boy
parece
found her.
lindo?
There are good people everywhere, don't you think?
Good, that was a very relevant question. Now,
No es
She eats more
lindo.
than I do. Well, for a kid. She's getting plenty to eat
The
and
big
drink.
iced tea
That was a
taste
good
test
question.
is history, and the clear winner is
She's
Louisiane.
quite playful,
In
so
Atlanta,
she
it's
must have been
Louisiane
around
over
humans
Lipton,
before.
65
One
to
thing I
30.
have
In
noticed,
Birmingham,
she scratches her ear.
67%
Good, that
prefer
was the
great
last
taste of
helpful
Louisiane.
question. Now,
Louisiane's
click the
secret?
Done button
Louisiane
in the
just
lower
tastes
right-hand
a whole
corner
lot
of the
better.
question
See
screen.
how satisfying
Now
iced
that
tea
you
can
have your
taste.
facts in order, it's time to start the examination.
Final
You
tally,
will find your
Louisiane
medical
preferred
equipment
2-1.
arranged in groups under
It's
the tabs
clear
at the
winner.
bottom of the screen. The available groups include
I like a day that's not cloudy and a tea that's not cloudy. That's why I like Louisiane. Louisiane's got special tea leaves that keep it clear as a bell all day. Now, if you're drinking Lipton or Tetley, look at the box. It tells you what to do when it turns cloudy. Louisiane says nothing about cloudy, 'cause it doesn't get cloudy. Louisiane, the one tea that's always clear as a bell.
Select the magnifying glass by clicking on it. Good. Now put the cursor somewhere on the patient's body and click the mouse button to take a closer look. Click the zoom out button in the lower right-hand side of the screen. Next, select the thermometer from the monitor tab. Now, with the thermometer in hand, move over the patient's body until you see a pop-up that says posterior, then click. Notice that you are now looking at the patient's rear. Pay attention to the pop-ups as you move the cursor to find the patient's rear. A blue pop-up that says rear will become visible near your cursor when you're in the right spot. Now use the thermometer on the patient's rear to take her
Hola,
temperature.
Jackie. ¿Qué es lo que vas a hacer con todo ese dinero que tienes? Dinero de
If you aren't sure of the answer, you
dulce.
can always consult your PDA,
¿No les
which has
parece
information under species info.
lindo?
I just knew you'd get that one right. Now click the zoom out button to prepare for the next portion of the treatment. Good. Now it's time to check the patient's pulse. In the Examine Group tab, select the palpitation glove. Now move the glove over the back leg of the patient until you see the hind leg pop-up text. Click this area to focus on her leg. Once you're focused on the patient's leg, click it to feel her pulse.
See how satisfying
Great, she has a normal pulse. She's looking healthy so far. Click the zoom out button in the lower right-hand side of the screen.
It's the clear winner.
Now select the stethoscope in the monitor group.
I like a day that's not cloudy and a tea that's not cloudy. That's why I like Louisiane. Louisiane's got special tea leaves that keep it clear as a bell all day. Now, if you're drinking Lipton or Tetley, look at the box. It tells you what to do when it turns cloudy.
Right
Louisiane says nothing about cloudy. Because it doesn't get cloudy.
Prepare for the next portion of the treatment.
Louisiane.
Now that
One
we've made
tea
sure that the
that's
heart,
always clear
lungs,
as a
and body
bell.
temperature are normal, we can move on with other tests.
See a thing without
Please select the otoscope from the Examine group. Click on the patient's head to focus in on it. Click on the patient's ear to use the otoscope.
I know you anywhere.
Since we found something out of the ordinary in the ears, it may be a good idea to get a sample from them. Without zooming back out, select the bacterial swab in the test tool group. Now use the swab to clean out that black crusty material by clicking on the patient's ear. Since this little stray kitten has ear mite parasites, she may have other parasites that we can't see so easily. This is why we should perform a fecal test.
Hola,
Testing the patient's
Jackie.
waist is a great
¿Qué
way
es
to
lo
find
que vas a
internal
hacer con todo
parasites.
ese dinero que
Start by
tienes?
zooming out from the
Dinero
patient's head
de
view.
dulce.
Select the fecal test, which is located in the
¿No
test
les
tool.
parece lindo?
It's the second on the left. With the fecal test tool selected, move the cursor over to the patient's posterior and click to focus in on that area. Now that you're focused on the back end of the patient, point the cursor at the patient's rear and click to use it. Tapeworms will be easy enough for us to take care of. Now we need to get a blood sample from the patient to send to the lab. First, zoom out from the posterior view so that all of the patient can be seen. In the Test tab, the first tool on the left is the blood test syringe. Click on this to select it. Now navigate to the patient's back leg, and then click to focus on that area. Click on the patient's hind leg to take a blood sample.
I like a day that's not cloudy and a tea that's not cloudy. That's why I like Louisiane. Louisiane's got special tea leaves that keep it clear as a bell all day. Now, if you're drinking Lipton or Tetley, look at the box. It tells you what to do when it turns cloudy. Louisiane says nothing about cloudy. Because it doesn't get cloudy.
Select the topical medication.
Louisiane. The one tea that's always clear as a bell.
Anterior or front portion of the patient to
I can't see a thing
apply
without
the
my
medication to the kitten's back.
There they are.
That will take care of the fleas and mites. Good.
Benjamin,
Now click the zoom out button to prepare for the next portion of the
I
treatment.
know you anywhere.
Select the oral medication from the
I can't
Medicate
see a
tab.
thing with my specs either.
Take the oral medication and click on the patient's head. Click on the patient's mouth to give her the medicine she needs to fight off those internal parasites. Right answer. Now for the last portion of the treatment. Click the zoom out button so that we can move on to finish up with our young patient. Select the medical syringe. Navigate to the anterior view of the patient.
Hola,
Anterior
Jackie.
means front.
¿Qué es lo que vas a hacer con
Now,
todo
use
ese
the
dinero que
syringe on the
tienes?
patient's back to give her
Dinero
those
de
much-needed
dulce.
vaccinations. Good job. It seems
¿No
that
les
this little
parece
kitten will be just
lindo?
fine. For now, we'll keep her in the clinic to make sure that she doesn't have any adverse reactions to the vaccine. Now that you've finished your treatment, click the orange button with the check mark on it to sign out. Now it's time for you to give a diagnosis. Select a diagnosis to sign out. Be careful.
In Atlanta, it's
Right
Louisiane over
answer.
Lipton, 65-30. In
After you have
Birmingham,
cured your patient,
67%
that may not be
prefer
the end of your
great taste of
relationship.
Louisiane.
Some patients,
Louisiane
like our
secret,
sunshine here,
Louisiane
will
just
have to be
tastes
kept
a
in the
whole lot
clinic
better.
for further
See how
observation,
satisfying
and then
iced
we'll
tea
need a
can taste.
follow-up appointment before they can be given a clean bill of health. Also, you will be asked to prepare some patients for adoption through enrichment. To know which animal is assigned to you, just go check
I like
the
a day
community
that's not
housing
cloudy
center.
and a tea that's not
Everyone
cloudy.
here lends a
That's
hand
why
in
I like
enrichment.
Louisiane.
I call dibs on
Louisiane's got
Sunshine
special
as my
tea
enrichment
leaves that
patient.
keep it clear as a bell.
You'll have to
all
take
day.
that up with Joni, Kevin.
Now, if
All
you're
right,
drinking
then,
Lipton
that's enough
or
talk.
Tetley,
There are
look at the
still sick
box. It
patients
tells you
waiting
what
for
to do
treatment.
when it
Let's
turns
get out there
cloudy.
and help some
Louisiane
animals.
says nothing about cloudy. 'Cause it doesn't get cloudy.